Well, good afternoon, everyone. Let me thank you all for being with us. I want to start off and ask all Georgians to join Marty, the girls, and me in praying for the families and loved ones of the 13 fallen service members in Afghanistan. These heroes gave the ultimate sacrifice serving our nation and helping those in need, and we will never forget that. I hope everyone would also join me in continuing to pray for the remaining American citizens and innocent civilians in Kabul. They are experiencing unimaginable circumstances, and I hope our nation's leadership and the international community will do everything in their power to bring our people home and protect those in harm's way. I'm proud to be joined today by our First Lady Marty Kemp, General Tom Cardin, Dr. Toomey, and Commissioner Kaylee Noggle, who's with the Department of Community Health. I'd first like to remind our state employees about the voluntarily scheduling their vaccination appointment before or on this Friday, September the 3rd. I want to thank all those employees who have already gotten their shot, and I hope everyone enjoys the long 4-day weekend. Vaccination remains our most effective tool against COVID-19, and I continue to urge all Georgians who have not done so yet to talk to a medical professional about getting vaccinated. To encourage more state employees who are members of the State Health Benefit Plan to get vaccinated, the Department of Community Health will immediately begin including full COVID-19 vaccinations as a well-being incentive for all SHBP members and eligible dependents. Approximately 325,000 members are currently eligible for the incentive, which would equate to a $150 Visa gift card or $480 in credits that can be used for various health care expenses like co-pays as well as co-insurance. This also includes state health plan members who have already been vaccinated. The deadline for eligibility will be November 30th of this year, and SHBP members will be receiving more information about this in the coming days. For well over a year now, the state has partnered with the Georgia Coordinating Center to provide logistics and coordination to EMS and hospital officials regarding bed and emergency room capacity statewide. The GCC has been very effective in aircraft traffic controlling, if you will, by ensuring that we are utilizing all of our hospitals and EMS resources effectively in our fight against COVID-19. They have done remarkable work and have certainly saved lives. Today, I'm announcing an additional $4.5 million for a total state investment of $6 million to strengthen their efforts. This $4.5 million allotment will allow the Georgia Coordinating Center to bring on more staff, improve technology and infrastructure, especially in rural parts of our state, and provide their critical service faster and more efficiently to their fellow healthcare heroes across Georgia. Over the last few days, my office and the Department of Community Health have received reports of healthcare systems having problems acquiring necessary healthcare supplies, specifically air gases like oxygen. Earlier today, I signed an executive order that waived the weight and hours limits for trucks to enable those life-saving supplies to make it to our hospitals quickly and efficiently. As we also prepare for the full effects of Tropical Storm Ida, this executive order will also ensure we can continue to get fuel to our gas stations across the state as fast as we can. Last week, I announced 105 National Guard members with medical training would be deployed to 10 hospitals across the state. Over the weekend, General Cardin deployed an additional 75 general purpose soldiers to aid those original 105 Guard members, bringing the total at those 10 hospitals to 180 Guard members. While we are limited in the number of medically trained Guard members General Cardin can call up due to their civilian employment, hospitals and healthcare systems across our state have started requesting Guardsmen and women for a variety of non-medical roles. Today, the executive order I signed earlier also enables the activation of up to 2,500 Georgia National Guard troops to be deployed at the discretion of General Cardin in coordination with the Department of Community Health based on need. Finally, today we continue to monitor the Tropical Storm Ida situation here in Georgia and across the Southeast. We have received multiple requests from our neighboring states, and GEMA is working through those now to see what we can do to help. I've spoken with General Carden and the Georgia National Guard. They stand ready to assist our neighbors in the event that they need it. We will continue to stay in contact with Louisiana, Mississippi, and any others to make sure that they have the support that they need to recover from this devastating storm. With that, I'll turn it over to Dr. Toomey, and then we'll take some questions.